person who dies from coronavirus cannot have their organs or tissue donated. They're medically ineligible.
The ramifications are truly understood yet of how transmittable the virus is.
CEO Jim Martin of Donate Life California, the state's donor registry, says life-saving transplants are still happening with non-coronavirus patients. But now there's added steps, testing the recipient and the organs for coronavirus.
It's not too different from testing for like hepatitis or HIV.
But the number of organ transplants nationwide dropped drastically in early March as the spread of coronavirus took hold of the country. Data from the United Network of Organ Sharing shows. In a month's time, living donor transplants dropped from 150 to 16 a week, and transplants from deceased donors dropped by more than half. The agency says this week, about 3% of those on the transplant waitlist have been temporarily deactivated due to coronavirus concerns. At UC Davis Medical Center, living kidney donor transplants were halted. Martin says many hospitals chose to do this to reduce strain on hospitals preparing to be overwhelmed. But he says he expects these operations can resume as long as the state stays the course in flattening the curve.
So I think hospitals are realizing, we can move forward with these life-saving surgeries.
But that decision is up to each individual and their transplant team.